Hello, my name is Stacy Michael, and I am applying to Jacksonville State University to the DMP Fall 2017 cohort. I have been a nurse since 2005. I was first a practical nurse and then obtained my associate's degree. I have worked in various places, different areas throughout the facility that I currently work in, as well as other areas throughout throughout my community. And I have included a slideshow here. This is my educational background. Again, I obtained my associate in science from Snead State Community College in 1995. My licensed practical nurse certificate in 2005, also from Snead State. My associate in applied science, ADN, in 2007 from Snead State. My Bachelor of Science in Nursing in 2008 from Jacksonville State University. And my Master's of Nursing in 2015, also from Jacksonville State University. My work experience, as you see, I've been employed with Marshall Medical Centers almost consistently since 2003 in various positions. I did have a small break where I decided to try occupational health and dialysis. Both of those I enjoyed and brought a lot of knowledge from them. I did work for Snead State Community College as an adjunct instructor from 2009 to 2016 and returned to Marshall Medical Centers in 2008, where I've worked in various areas such as med-surg, outpatient services, perioperative services, and currently I am working in quality management as a abstractor and sepsis coordinator. And in 2016, I began working at Northeast Alabama Community College as a nursing instructor, and I have found that very fulfilling. I would like to obtain my DMP from Jacksonville State University, first and foremost because I'm alumnus of Jacksonville State. I have found that the instructors, the atmosphere, the classes are very well structured, meet my needs perfectly, and the instructors there have been wonderful to me and have helped tremendously. As far as my reasons for obtaining my DMP, I've always wanted to continue my education, further my education, and the nurse practitioner track has always been in the back of my mind. I love education. I'm thoroughly enjoying my position. However, I feel that I could make an impact in the clinical environment as well. One of the theories that most relate to my nursing practice is the comfort theory, and it stresses institutional integrity. And I feel in this day and age there are so many issues with institutional integrity, and I want to be able to contribute positively to my local community through the care that I can provide as a nurse practitioner. I have worked for Marshall Medical Centers since 2003, and they have instilled in me values of core values that I will take with me throughout my practice. They value institutional integrity and strive very hard on a daily basis to ensure that that is maintained. And that has become an integral part of my practice as a nurse and my time as a nursing instructor as well. I feel like my community is in need of quality healthcare, quality practitioners. There are so many out there, but there's also a need that is not being met. There's so many underprivileged, underserved areas in my community, and I would like to impact that in a positive way as a nurse practitioner. I have in the past felt a strong need to serve in the mental health forum. And I still feel like that is important because I do feel like, especially in my area, there is such a high amount of drug abuse, and it's becoming more and more rampant. And I feel like addictions, mental health is a very underserved area, and I can see myself going in that avenue. Again, I love my instructor position and plan to continue that. I feel like I am providing a great service. I feel like I'm helping to mold the nurses of tomorrow. And I hope I'm doing that in a very positive way. And I would like to continue to do that. But I also feel so drawn to the clinical portion of my nursing career. And I would like to be able to continue that and work in my area. As far as leadership and management, I served as a leader in my area when I worked in perioperative services. I feel like I have a lot of skills that make me a good leader. I'm a good listener. I'm compassionate. I'm not afraid to work. I am one of those people that feel like I'm not going to ask you to do something if I'm not going to be willing to do it myself. As far as management skills, my time in quality management at Marshall Medical Centers has been invaluable. There's so many aspects of the inner workings of a hospital that I did not realize until I went to this department. As nurses in clinical practice, we tend to only see in our small tunnel, and working in quality management has really opened my eyes to the financial stressors of a hospital, the quality clinical areas, the core measures, the different things that have to be met, and made me understand what maybe I didn't understand as a nurse before, why things have to be done the way they are, why there's so many rules and regulations. And I feel that experience will help guide me to be a practitioner who will be worthy of saying that I value institutional integrity. I do my professional goals. I do want to obtain this degree in an amount of time that's suitable to the program, and I want to practice in my area. I've always heard people say, I'd like to go to this place or that place. I feel like my community needs me. My community needs quality practitioners, and that's where I would like to be. I would like to be impacting them. Being here at Northeast Community College, there's such an emphasis on community here, and I see how important that is and how that needs to be further advanced. So I want to be able to do that not only here at Northeast, but at Marshall Medical Centers or somewhere in my area, that area. I said that the theory that I most closely relates is the comfort theory. Comfort is so very important. Patients have to feel like they are taken seriously and have to feel like their needs are met. And I think, especially in the area where I'm from, those needs are not always being met for every population. And I see that more in quality management, and I want to work towards making a difference and making sure that those needs are taken care of, that those needs are met in whatever capacity I can. I appreciate the opportunity to be able to do this. I have been blessed beyond measure to be able to continue my education. I have a very loving and supporting family who have stood behind me and who support every decision I make. And I'm just thankful for that. And I'm just putting this in God's hands. And if this is meant to be, then I will be admitted in the fall. If it is not, then it was not God's will. So I appreciate your time and attention, and look forward to hearing from you. Thank you.